We want to begin this morning with the COVID-19 pandemic as cases across the country surge, fueled by the highly contagious Omicron variant. Speaking yesterday, President Biden said we should be concerned by the new strain, but he also reassured Americans that the country is now better prepared than it was at the beginning of the pandemic. The president announced new measures to ramp up COVID testing and urged those who are not yet vaccinated to get the shot as soon as possible.
If you're unvaccinated, you're at a higher risk of getting severely ill from COVID-19, getting hospitalized, and even dying. So the best thing to do is get fully vaccinated and get your booster shot. And no, this is not March of 2020. 200 million people are fully vaccinated. We're prepared. We know more.
NBC News White House correspondent Mike Memoli joins us now. So, Mike, we've heard this message to get vaccinated many times before from the president, but he seemed to really go after those who've held off getting a shot this time, didn't he?
Yeah, Joe, that's right. There's a very specific audience that the White House had in mind for the president's address yesterday. They think it's the majority of Americans who've been vaccinated, have largely been doing all the things that they've been asked to do throughout this pandemic to try to put it behind us, like wearing masks and the like. And they know that that audience is extremely frustrated that we're still dealing with these kinds of restrictions. That's why the president said he shared their frustration. Now, part of the White House's calculation is that that audience wants to hear some criticism of those who are really, in their view, responsible for us still being in this position and those who aren't who are unvaccinated. Here was the president's message to that audience.
All these people who have not been vaccinated, you have an obligation to yourselves, to your families, and quite frankly, I know I'll get criticized for this, to your country. Get vaccinated now. It's free. It's convenient. I promise you, it saves lives. And I honest to God believe it's your patriotic duty.
So, Joe, let's be honest, that holdout group, those who haven't been vaccinated, those who are protesting mask vaccine mandates and the like, maybe weren't watching the president live yesterday, but the president still had a message for them. He brought up the former president, Donald Trump, the fact that he got boosted. He also gave his administration credit for putting the U.S. in the position of having a vaccine earlier than so many other countries. It's a message that maybe they didn't hear in real time, but maybe they will down the road.
Yeah, we'll see whatever it takes at this point. Now, the Biden administration, Mike, has been criticized by some for being too slow when it comes to making COVID tests available. So how is the president planning to try and ramp up testing?
Yeah, this was a speech yesterday that was designed to show that the administration is on offense regarding the pandemic, but the president was clearly on the defensive on this issue of testing. He laid out what the administration is doing, making these take-home tests available to anybody who requests them, also ramping up the testing sites around the country, including the first one opening this week in New York. But it was obvious that he was defensive when asked about why these measures weren't taken sooner. He explained that, listen, anybody who told you that this variant, the Omicron variant, was going to replicate and become the dominant strain so quickly, you would have thought that they were crazy. Now, a lot of people don't think that's the case. And remember, Vice President Harris said something similar a few weeks ago, walked that back. So this is an issue the White House is going to be explaining their way through for some time.
Now, Mike, the rise in hospitalizations we're starting to see is coming at the worst time, with many hospitals. They're understaffed, they're overworked. Will we see more action from this administration, from the federal government in the coming days or weeks to address that specific problem?
Yeah, obviously the big headline yesterday was revolving around the issue of testing, but the White House also taking very important steps to try to aid that very strained, overstrained healthcare workforce, doctors and nurses, some of whom have even left a lot of these hospitals, which is going to be an issue as we see the numbers rise in the coming weeks. And so that's why the president is deploying 1,000 military doctors, medics, to surge areas where they determine that they are in the need the most. The Department of Defense will be doing that as needed, they say. They haven't done anything yet. It's likely that they will not be able to do so until January or February at this point. But the White House is also saying that FEMA is going to be surging some response teams to also add beds and the like to make sure that these hospitals, which continue, we see the numbers rising on a daily basis, will have additional capacity should they need it.
All right, Mike Memoli reporting from the White House. Thanks so much, Mike.
Thanks, Joe.
Now, cities throughout the U.S. are scrambling to boost their COVID testing capacity as the Omicron variant sweeps across the country. Many Americans hoping to get tested for the virus have been forced to wait in long lines at testing sites. Some are also faced with a shortage of rapid testing kits in pretty much every store they visit. NBC News reporter Gary Grumbach is outside one of those testing sites in Washington, D.C., which gives us really an idea of what's happening in a number of major cities right now. Gary, good morning. So what is that city's plan to get more people tested for the virus?
Hey there, Joe. Yeah, we've seen this scene before major holidays over the past 2 years. Long lines at testing sites, but with nothing like what we've seen around the country over the past few days. D.C. Health has seen it too. We're here at Farragut Square. They've been having a PCR testing site here for the past 2 years, really since the pandemic began. I'll tell you, there's already a few people in line. This site doesn't even open until 8 a.m. But D.C. is starting to ramp up their rapid testing capabilities. They're starting what they're calling Test Yourself Express today. There's 8 libraries across the city of Washington, D.C. that are going to be handing out 1,000 free rapid tests. You can get them at the library if you're a D.C. resident, take them home. It takes 15 minutes to take the test. That's part of what they're doing here in D.C., along with what you were just talking with Mike about on the federal level.
So, Gary, we know Washington, D.C.'s Mayor Muriel Bowser, she's announced a new plan to expand the city's testing capacity. What more can you tell us about that?
Yeah, it really does seem like D.C. Health and health departments across the country were caught a little bit flat-footed with just how fast Omicron is spreading. And because of that, people may not want to wait 2 or 3 days to get the result. So they need the rapid tests. Right now, D.C. has 40,000 rapid tests on hand. They say there's 200,000 in transit. This week, Muriel Bowser announced 1 million rapid tests are on their way to D.C. in an order just placed, but those won't come until January. Joe?
Hey, Gary, as cases rise in the nation's capital, what is the city doing when it comes to a mask mandate?
Yeah, Joe, if you've been following D.C. health regulations pretty closely, you'll remember that there actually was a D.C. mask mandate just before Thanksgiving. Mayor Muriel Bowser then lifted that mask mandate, and it only lasted about a month. This week, it is back in place in all public places indoors. Of course, that never left in places like hospitals or schools, but it's now everywhere indoors in public places. But just anecdotally, I'd say it really never left at all, because whether you're in a Trader Joe's or a supermarket or a shopping center, it really did feel like people were wearing masks throughout the past few months.
Hey, Gary, I mean, we're just a few days away from Christmas there in D.C. What's it like? Are there a lot of people there? People left town? Do you get a sense that people are changing their plans? What's sort of the mood and environment there?
Yeah, D.C., as you know, Joe, is a real transient city. There's a lot of people coming in and out, of course, to their districts if they live on Capitol Hill or, elsewhere. And so right now it's definitely an emptier city. But when they come back, they're going to be coming back from across the country where COVID is spreading at various rates. So that's something to look for, too, after the holiday week.
All right, Gary Grumbach reporting from the nation's capital. Thank you so much. Now, the recent sharp rise in cases is pushing thousands of patients into intensive care units that are already overwhelmed. In response, healthcare workers are now pleading with the public, asking all of us to take more precautions against COVID. The average number of daily COVID hospitalizations nationwide, nearly 69,000. That's up 14.2% in just the last 2 weeks. ICU hospitalizations, intensive care units, are up just over 9%. Doctors and nurses are at their limits, reporting exhaustion and fatigue as they face yet another COVID wave. Let's bring in NBC News reporter Daniela Silva for more on this. Daniela, we've seen healthcare workers express exhaustion and fatigue throughout this pandemic, starting in March of 2020, now again. Does this feel different this time around for healthcare workers? What are they seeing inside their hospitals right now?
Good morning. Hospitals told me that they are once again seeing their numbers skyrocket, and some are at a breaking point. This time, the surge is fueled by the arrival of the highly contagious Omicron variant, the ongoing battle against Delta, unvaccinated patients needing treatment, and managing a shortage of much-needed staff. One health official told me in the Minneapolis area, there are 200 to 400 people every morning in emergency rooms waiting for beds they need to open up. A hospital there brought in a refrigerator truck to help its morgue capacity. Cleveland Clinic in Ohio said many ICUs and emergency rooms are at 100 to 120% capacity.
And that's what we're seeing right now, and we know there's still going to be even more cases going up after the holidays, especially with the number of families getting together. I want to talk about Massachusetts. Just yesterday, the state announced it will be calling on the National Guard to help with the surge of cases. Let's take a listen.
Hospitals across Massachusetts are experiencing an unprecedented demand, and there remains a critical staffing shortage in many jobs and many roles to meet the needs of our patients. We're committed to ensuring our healthcare system meets the acute care needs of our residents. To support hospitals that are experiencing staffing shortages, the governor is activating up to 500 members of the Massachusetts National Guard to ensure sufficient non-medical personnel are available to deliver support to patients.
Daniela, how are these staffing shortages impacting care in states that are just so desperate for help right now?
Yeah, healthcare officials told me the staffing shortages right now are a national crisis, compounded with wave after wave of COVID cases. In Rhode Island, one wrote a letter to the governor saying emergency departments were reporting anywhere from 25 to 50% of their nursing positions vacant, and inpatient units were equally starved for staffing. At Cleveland Clinic, officials said they haven't had enough nurses, enough personnel to just deal with the surge of patients. They said the healthcare community's biggest fears right now are patients dying because of treatable illness or not receiving the appropriate care they need because of these shortages.
So Daniela, with Omicron now the dominant strain in the U.S., quickly becoming the dominant strain, how worried are healthcare workers about the weeks ahead?
Healthcare workers told me the next few weeks are exactly what they fear as Omicron cases rise, while many are still battling the Delta surge too. In Massachusetts, one official described it as an impending sense of doom. Others have said they're really terrified of what's to come, and they can't imagine having to treat more patients than they are now.
All right, Daniela, you can read more of her reporting on NBCnews.com. The headline, "I am terrified right now." That's a quote from a healthcare worker she spoke with. Thank you so much. Let's bring in Johns Hopkins Center for Health Security senior scholar, Dr. Amish Adalja. Doctor, good to have you with us this morning. So as we just heard, hospitals being pushed to their limits again. What do you think of the president's plan? Will it do enough to try and slow down the virus and help out the frontline workers?
The most significant part of the president's plan is the way that he's mobilizing federal assets to help hospitals that are in hard-hit areas, to make sure they have capacity, to make sure they have staffing. That's going to be the most welcome part of that. We know that the next couple of weeks to maybe a month or so is going to be rough. Hospitals are already getting crushed with Delta, and now they're going to get Omicron patients. The antiviral that may be getting approved in the next day or so, that's also going to play a big role. But we have to remember that this is going to be a very hard thing to completely stop because Omicron is spreading very quickly, and we still have a large swath of the population unvaccinated, therefore susceptible to hospitalization. So it's going to be kind of touch and go at certain hospitals in certain parts of the country. It's probably not going to be a systemic problem, but a regional problem that can be very, very difficult to easily solve.
Doctor, with Christmas just a few days away, testing is on everyone's mind. When it comes to the increased demand we're seeing for those COVID tests, how do you think the federal government is doing to meet the challenge of getting more Americans tested? Did what the president announced yesterday, is that going to help, or might it be a little too late in this process right now?
It's definitely too late. This is something we needed a month ago. This isn't something new. We've had shortages of home test kits for a long time. I can remember a couple of months ago having my friends drive to outlying counties to try and find tests. It's not easy to do. And this is something that should have been anticipated. Throughout this pandemic, we've always under-tested and undervalued testing during the prior administration and even during this administration. So what we have to really do is optimally use these tests so that people can navigate their lives, so that they can go about the world in a world in which there is a pandemic going on, but have minimal disruptions. So when these things start to come around in January, the 500 million tests start to arrive, a lot of people's need for them now for Christmas break is going to have already expired. So I think we have to really think more proactively about this, and it's going to be difficult because these tests are not going to be in great supply in the next couple of weeks.
It is hard to believe we are this far into the pandemic and still having testing issues right now at so many different levels. For those Americans out there who've not been able to get a test yet, but they think they may have been exposed to the virus, what advice do you have for them, especially if they are or maybe they were planning on spending time with their families over the holidays?
Well, I think, first of all, if you're vaccinated, realize that you're going to have a very mild illness, and if you can get a test to clear yourself to be able to be around people, that's going to be important to make your gathering safer. If you're unvaccinated, you're probably going to have a hard time clearing that virus within that 10-day period of isolation. I think I would just tell people to be tenacious. You can maybe find tests somewhere. Maybe one of your friends has tests that they've stocked up. Use the online ordering at some of the big box retail stores. You got to really just be innovative. And it's unfortunate because this is something that the government should have anticipated and made it much easier because they knew that this was going to be a disruptive force.
Dr. Adalja, for those who maybe haven't been exposed, or at least that they know of haven't been exposed, but are just anxious and they're debating, they're supposed to leave a day or two from now, and they're wrestling with that decision right now, what are the things you want them to think about as they try and make that decision?
If they're fully vaccinated, I think they should and they don't have any symptoms, and they've not knowingly been exposed, I think they can go about their holiday normally. I think that hosts of these holiday gatherings need to come up with a policy or an idea of who they're going to test and who they're not going to test. I don't think it's necessary to test every vaccinated person who has no symptoms, but that's based on the risk tolerance of the people having the gathering. The safer the gathering, the more vaccinated people that are at these gatherings, the safer they'll be. So in that situation, I don't necessarily think you have to test. It's when you've got mixing with unvaccinated individuals, when you've got people who have been exposed, that's where the tests become much more valuable. But for unvaccinated people, I think they can basically go about their holiday free from the worry that COVID is going to be serious, even if it does occur in one of the guests that's there, because that's the point. We're on a two-track pandemic. Vaccinated people have very mild illness, and that's to be expected. It's the unvaccinated that we worry about because they have the ability to crush our hospitals.
All right, Dr. Amish Adalja, as always, we appreciate your expertise and your advice. Thanks so much. Now, with those hospitals pushed to the limit by this latest wave of COVID, as we just heard, the Pentagon is preparing U.S. troops to join the battle. Their mission, helping out exhausted healthcare workers across the country. NBC News Pentagon correspondent Courtney Cubey has the details.
On Tuesday, the Biden administration announced that they had directed the Pentagon to prepare up to 1,000 members of the U.S. military to deploy across the country to support the outbreak of COVID. Now, there already are about 250 members of the U.S. military spread around the country in 7 states at about a dozen civilian medical facilities. They're there supporting the local medical staff, who in many cases are just overwhelmed by the number of COVID cases that they're seeing on a daily basis. You may remember early on in the pandemic, the military deployed these large groups of medical professionals around the country to help support with the outbreak. Well, what they learned in cases like sending the USNS Comfort up to New York was they just didn't get that many patients. They realized that they were much more efficient by sending these small medical teams around the country to civilian facilities to help these overwhelmed local doctors and nurses. That's what they've been doing. Most of the teams are about 20 people. They move into the civilian facilities, and they just augment the medical personnel there that, again, are just overwhelmed by these outbreaks. Now, we don't expect the first numbers of these 1,000 people to actually be moving out to these facilities until January or maybe even February. What they're waiting for is FEMA to put in the requests for what they need and where they need it. Again, defense officials expect these to be smaller teams, somewhere in the neighborhood of 20 people, largely doctors, nurses, and paramedics that will move into civilian facilities, and they will help these overwhelmed local staff.
Thank you, Courtney. Let's get a check now on your morning news now. Weather, Michelle Grossman is with us. Michelle, good morning.
Good morning, Joe. Happy Wednesday. And we are looking at some snow for some and a lot of snow. We're talking about measuring in feet. But first, let's start in the New England area. We're talking about inches there, generally 2 to 4 inches in some spots, but some spots could see over 8 inches of snow. So we do have winter weather advisories, winter weather warnings. That's in the pink in northern Maine. As we see a coastal low that's going to bring some snow today, even some rain and ice from Long Island to Maine. That's what we're going to be watching in the northeast today. Otherwise, as we look towards the snowfall totals, I mentioned over 8 inches in some spots. I'm sure lots of northern Mainers are very happy about that. Now, as we scoot to the west, we've been so active this month that we're going to continue to be very active over the next several days. So we're looking at a series of storms moving inland, and we're looking at a ton of winter storm warnings, a ton of winter storm watches as we stretch from the Pacific Northwest through California into the Intermountain West. And this is where we are measuring the snowfall in feet. So you can see generally 6, even up to 12, 24, and over as we look at the higher mountains of the Sierras. Now, we have quite the contrast, though. So we have the snow in parts of New England. We have the snow out to the west, and that will remain very active over the next several days. And then sandwiched in between, we are so above normal. We're going to continue to see these temperatures very, very warm today, tomorrow, Christmas Eve, and also Christmas. So as we look at the temperatures, Denver, 22 degrees above normal for this time of year, 64 degrees. Today in Lubbock, 69. That's 18 degrees above what is typical for this time of year. And San Antonio, 73. And then look what happens tomorrow. It sort of just expands. You can see those colors on the maps, the pinks, the oranges, indicating that very warm air in place. So Midland, Texas, 81 degrees tomorrow. That's Christmas Eve with 25 degrees above normal for this time of year. 73 in Dallas and 77 in Austin. Then we're going to see this heat move off to the north and east. So by Christmas Day, we're going to be very, very warm in parts of the mid-Atlantic. Washington, D.C., you could be close to 60 degrees, while we're going to be turning colder and more average in parts of the Great Lakes into the upper Midwest. Look at the upper Midwest. Pretty chilly on Saturday, 26 degrees, below freezing on Sunday, 28. Still in the 50s and 40s in Chicago and Cincinnati, we're looking at 60 degrees. So we're all across the board in terms of the weather. Joe, when I come back in just a bit in the next hour, we're going to talk about travel forecasts. We're looking pretty good, but we do have some travel spots across the country.
All right. A lot of folks will want to hear that. Michelle, thanks so much.
Yeah.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.